and welcome to Healthy Nation. I'm Dr. Carrie Peterson. It's normal for people to feel depressed or blue from time to time. Unfortunately, many of these episodes don't last long. But for some people, those depressed moods turn into clinical depression and affect their lives for long periods of time, interfering with daily activities and relationships. This is called major depressive disorder, a real medical condition that shouldn't be taken lightly. Major depression causes a range of symptoms, including both psychological and physical ones. But sadness and a loss of interest in daily activities are two of the most common. People who have major depression also often feel a lack of motivation, which can be so severe it's tough just getting out of bed. So it can be frustrating and painful. This type of depression is common and affects both men and women. But women are 2 times more likely to develop it. You're more likely to develop it if you have a family history of depression or have experienced an earlier episode of depression. People who abuse alcohol and other drugs are more at risk, along with people who don't have a strong social support system, like friends and family. Major depression is also episodic, meaning it can come and go, and those down moods can last for months at a time. About 60% of people who suffer one episode of major depression are likely to have more over time. Major depression is treatable in many cases, though, but in order to treat it, you must be diagnosed. I mentioned a few of the symptoms earlier. Let's go through all of them now. Overwhelming sadness, lack of interest in activities, weight loss or weight gain, changes in sleep, either sleeping too much or experiencing insomnia, fatigue or extremely low energy, feelings of worthlessness, trouble concentrating, and thoughts of suicide. While these are the classic symptoms of major depression, it doesn't affect everyone in the same way. Some people may feel anxious or even physically sick. If you're experiencing 5 or more of these symptoms, with at least one of them being depressed mood or loss of interest or pleasure, for most of the day, nearly every day, for a minimum of at least 2 consecutive weeks, talk to your doctor. He or she will ask you questions, including details about how you feel. You may also be asked to fill out a questionnaire that helps diagnose depression. There is no single test to diagnose it, but since some medical conditions, like Parkinson's disease, seizure disorders, stroke, and thyroid problems, among others, are associated with depression, your doctor will do a physical exam and tests to check for those illnesses. Medications may contribute to depression as well, so your doctor should ask about everything you're taking: prescription medications, supplements, even recreational drugs, and your alcohol intake, which is a natural depressant. What's most important is that you work with your doctor to understand whether your down moods are due to major depression, which can be effectively treated in most cases.